Let us have a quick discussion about measles, mumps, and rubella, very frequently asked questions from the public health point of view. So, first MCQ for you to understand that what are these measles, mumps, rubella? Are these some fever and rash disease? Of course, they are, but they are also classified as respiratory borne infections. They are respiratory borne infections because predominantly the route of spread or the mode of transmission is a respiratory mode. So you can see this person over here. If a person would sneeze or cough, there'll be a lot of droplets coming out. There'll be bigger droplets, smaller droplets, and that's what is the Big Bang theory. And that's how I think the world also started, by coughing or sneezing. Let's go ahead and talk about the first disease, that is measles. So first MCQ in measles is, what are the epidemiological determinants? So we need to talk about the epidemiological determinants. We always talk in terms of agent factors, host factors, environmental factors. So that is your first topic, agent factors. The measles virus, it's a viral disease, right? It is a single-stranded negative sense RNA virus. It is from the family of paramyxovirus morbilliform viruses. What is the source of a person to have infection? First MCQ, the source is always a case of measles. It is very interesting to note that there is no carrier stage that we know of in measles, and very few means very less subclinical cases. In fact, earlier we used to think there is no subclinical case, but there are very few reported subclinical cases. There is no animal reservoir. So the only problem is a human being getting a case of measles. That is the only problem, because they are the only people who are transmitting viruses. Next MCQ is talking about the period of communicability. Let us say that this is the time of onset of rash. So let us say on day 1 the rash started. So 4 days before the rash, 4 days before the rash, and 4 days after the rash, after onset of the rash is the period of communicability. That tells you that during the rash again the children might be communicable. What is the immunity level? Please note that measles again has a very low, in fact a negative or a minimum. Negative. I'll repeat this point. Talking about the immunity beta, please note that the measles disease or the measles virus, it has a almost zero or negligible second attack rate. Again, I'm not trying to confuse you. I'm not saying the secondary attack rate. I'm saying the second time attack rate is very low. Please note that one natural infection may usually have a lifelong immunity. I would also like you to remember that what is the secondary attack rate of measles? The secondary attack rate. Now I'm talking about the secondary attack rate. The secondary attack rate of measles is very high. Roughly around 80 to 85% in the unimmunized children will develop the measles, because the measles is highly infective disease. Coming over to the next topic, what are the host factors? The host factors, if we talk about the age, predominantly the age for measles is in very small children, that is not very small, 6 months to 3 years. That is the predominant age. So this usually happens in the developing country. Developing countries will have 6 months to 3 years. That is below 3 years. That is the peak age. And can you believe that in developed countries like bigger countries, the bigger powers of the world, so in those areas more than 5 years is the predominant age for children to develop measles. That is in this age group. Next is about the nutrition status. Of course, I think everybody knows that in cases of more malnutrition, there is more chances of measles. Why? Because the children will not have the appropriate immunity. Environmental factors. Measles can occur at any season. There is no seasonal association. However, measles is known to have slightly more peak during January till April. What is this month? That is the winter. And the spring months. So that is kind of more, but it can happen in any season. Please note that measles is only peaking in this area, but it can happen in any of the season. What is the mode of transmission and the incubation period? MCQs, a lot of MCQs come on incubation period. Beta, it's a frequently asked question. The incubation period for measles. What is incubation period? It is the time from the entry of the organism to the first sign and symptom. So if you take the first sign and symptom as fever, so the incubation period for fever is roughly around 10 days plus minus 1 day. So measles is a very highly targeting type of virus. So fever is plus minus 1 day, 10 days is the average. If you talk about rash, it is roughly around 14 days. From 12 days to 16 days, plus minus 2-3 days left and right, it is 14 days is average incubation period for fever, for rash to develop from the onset of infection. And third point is in case of the vaccine induced measles. Vaccine induced measles. So what happens is that the vaccine that we give for measles, that is a live vaccine. So now in some cases the live vaccine may even cause measles, and because the live vaccine may cause measles, there has to be incubation period, and the understanding is very important, because I'll talk to you about this understanding again when I discuss the vaccine. So the vaccine induced measles, please note, it has been asked multiple times in your exam. The vaccine induced is 7 days. For normal measles, it is taken from 12 to 16 days. Rash is 14-day average median incubation period. So what I have written over here, what you need to remember is median incubation period. Next is, what is the mode of transmission? Please note that the measles is predominantly a respiratory mode of transmission. It is a droplet mode of transmission. It is usually through the oral secretions and through the droplet nuclei. What do you mean by the droplet nuclei, beta? That is what is the airborne mode of transmission. Just to remind you again, what are the diseases which have airborne mode of transmission? The airborne mode of transmission could be in IM, CTC. You remember, that is influenza, that is measles, and then you have chicken pox, and then you have tuberculosis, and last is your COVID-19. So that is the airborne infection is there in very few diseases, and these are the diseases you would like to remember. The next is the clinical features. The clinical features for measles can broadly be classified into prodromal stage, eruptive stage, and post-measles stage. Simple. So prodromal is before the eruption, before the rashes. In prodromal stage, there is characteristic fever to the child. There may be some coryza, some running nose, some non-specific features. The prodromal stage could last anything from 3 to 5 days. It could last anything from 3 to 5 days. The next, after prodromal stage, please note that in prodromal stage, this is also one MCQ. In prodromal stage, even the child may present with diarrhea. It may present, I'm not saying it always presents, but diarrhea is not uncommon feature. It's not a rare feature in measles. So diarrhea is kind of there in measles. So that is one thing for us to know in the prodromal stage. Next is that after prodromal stage, the child is going into the rash phase or the eruptive stage. Now 2 to 3 days before the eruptive stage, that is within the prodromal or during the onset, there could be formation of Koplik spots. What are Koplik spots? As you can see in the image over here, you can see small whitish kind of spots. These are small whitish spots which are in the buccal mucosa, in the lower first and the second, near the first and the second lower molars. So that is the classical point of having Koplik spots. Please note that Koplik spots, they are what? Many of you must already be knowing. It is a pathognomonic of measles. You don't find Koplik spots anywhere else. You see Koplik spots, answer is measles. But measles may or may not have Koplik spots. Not every case of measles is going to present with the Koplik spots. But you see Koplik spots, that is sure shot measles. So Koplik spots, when do they develop, beta? 2 to 3 days before rash. 2 to 3 days before rash we have as Koplik spots. Next is, if we look at the eruptive stage, in the eruptive stage, there is onset of the maculopapular rash. First MCQ, where does the rash start from? The rash will start, typically it starts happening behind the ears. Behind the ears, posterior auricular rash. So you have behind the ears, the rash will start. So from the face, it will extend down. It usually takes 2 to 3 days to extend to complete body, extend to whole body. And then it takes another 4 to 5 days to disappear. So total we can say that usually it takes 6 to 7 days to 7 days. That is the total time for the rash to be there. 2 to 3 days to spread down, and then 4 to 5 days it usually fades off. That is what is the eruptive stage, and these are usually starting in the behind the ear. And then behind the ear. And then you see the post-measles stage. In post-measles stage, the virus shedding is over. Please note that there is also another MCQ, that when is the peak virus shedding? The peak virus shedding usually happen 2 to 5 days after onset of rash. It happens in the first 2 to 5 days of the onset of rash. That is the peak time of a child to shed the viruses. In the post-measles stage, please note that the child will usually have a lot of weakness, or there is intense weakness, and there is a lot of weight loss. So that was general features about the clinical features about measles. Coming over to the important topic, frequently asked, this is a 3 by 5 star topic for your exam. What are the complications? The complications in children may develop any type of inflammation within the body. Usually the child may develop otitis media. There could also be pneumonias. There could also be brain inflammation, that is encephalitis, or any visceral inflammation. So that could be dependent on the immunity status of the child also. MCQs over here. Please note first MCQ, which is the most common complication. The most common complication is otitis media. Second question, which is the most common fatal or a severe complication? Please note that the fatal or the severe complication is pneumonias. If a child will develop pneumonia, usually the pneumonia is very severe, and again it may be fatal. Most common cause of death. COD stands for the cause of death. Most common cause of death in a child, in case of a child with pneumonia, with measles, is pneumonia. So, and of course, please note that the rare features are SSPE, subacute sclerosing panencephalitis, or other types of encephalitis. There is one related question over here, that do you know that in measles, which is the most common associated feature? Most common associated feature apart from fever and rash. What is measles? Measles is fever and rash. So most common associated feature apart from measles and rash, apart from fever and rash, that is diarrhea. Diarrhea is the most common associated feature. Otitis media is the most common complication. Pneumonia is the most common cause of death in children. In pregnancy, the measles does not cause any severe infection to the mother or to the child. However, in pregnancy, if a female is pregnant and she gets measles, there are very high chances of abortions. Abortions of fetal wastage or miscarriages is there in pregnancy. Otherwise, just remember that these are like many times they have asked questions on complications of measles. Next is, how do we diagnose measles? What is the management strategies, and what are the other things you would like to remember? As far as diagnosis, it is predominantly a clinical diagnosis. We do not do any serological test or any PCR. It is based on the clinical diagnosis. However, the confirmatory or the gold standard test is a PCR test. PCR test for measles is one of the gold standards. What is the management? There is no treatment for measles, but you should remember, this is a 5-star MCQ topic. You should remember, what about the vitamin A prophylaxis? I told you that measles happens in what children? We already talked that one of the risk factor for a child is malnutrition. So malnutrition child will develop measles, and measles in the post-measles phase will cause malnutrition. So that's a big vicious circle. And you should be giving, the Government of India in Ministry of Health and Family Welfare, everywhere in the sub-center, in the PHC, CHC, everywhere, everybody would be giving vitamin A prophylaxis. So what is the dose? It's the same dose that you already know. So in every case of measles, we are supposed to give vitamin A prophylaxis. Same dose, beta, no brainers on this. If the child is less than 6 months of age, the measles would be very rare, but in case the child is less than 6 months, then the dose is 50,000 international units. 50,000 international units. If the child is 6 months to 1 year of age, the dose is 1 lakh international units of vitamin A. And if the child is 1 year till 2 years of age, the dose is 2 lakh international units of vitamin A to be given to every case of measles. So moving next is measles vaccine. Beta, measles vaccine is a 5 by 5 star MCQ topic. It has been a frequently asked topic in your exams. We have discussed much in detail about measles vaccine in your immunization session also. Over here, let us just focus again and do the repeat revision of what you have studied in immunization. First MCQ, what is the strain of the vaccine? The strain of the vaccine is Edmonston Zagreb strain. Edmonston Zagreb. What is the type? It is a live attenuated vaccine. Live attenuated vaccine. It is a freeze dried vaccine. It is a freeze dried vaccine, and please note that because it is a freeze dried vaccine, you can't give a dried substance as injection, right? So you need to dilute it. What is the diluent in measles vaccine? In measles, we give M for measles, W for water. So in measles vaccine, we give water. Which water? It is a distilled water. Please note that in measles vaccine, we are going to give you are going to dilute it with distilled water. So it is a freeze-dried vaccine, which is a live attenuated vaccine. You should also know that the measles vaccine in Government of India or in anywhere, we can combine it with many other things. You can have a measles rubella vaccine. You can also have a measles rubella mumps vaccine. You can also have a measles mumps rubella and a varicella vaccine. So all these vaccines which contain measles, these are generally called as measles containing vaccine. So don't get confused when I say MCV. MCV does not stand for meningococcal vaccine. It stands for measles containing vaccine. So MCV is measles containing vaccine. What is the dose of this vaccine? The dose is 0.5 ml. It is given as subcutaneous. Please note that in Government of India, we are giving it as subcutaneous. It can be given as intramuscular also. So the dose we give is 0.5 ml subcutaneous. Where do we give it? We give it in the right upper arm. You give it in the right upper arm of the child. When do we give it? We give it at 9 months of age, followed by a second dose at 16 to 24 months of age. Next is a lot of confusions on this. What is the duration of immunity of this measles vaccine? Please note that if a child takes the measles vaccine, the development of immunity, it starts within 11 to 12 days after vaccination. The immunity of the child will start developing against measles. This happens for almost lifelong. So if it happens for lifelong, why do we give 2 vaccines? Why not 3 vaccines? Please note that measles vaccine is a super vaccine. It's a beautiful vaccine. And do you know that the measles vaccine, if you give first dose, let me just take a new page. The measles containing vaccine, I hope you know what is MCV. If you give the measles containing vaccine, the first dose, the immune protection of the child is roughly around 85%. And can you believe that if you give the second dose, how much protection does it give? It gives a whooping 98% protection to the child. So it's such a beautiful vaccine. 98% protection guaranteed by the measles. Of course, nothing is guaranteed, but 98% protection is given by the measles containing vaccine. That means what? That brings you down to a very beautiful understanding. Where is the measles virus? The measles virus is where? There is no animal reservoir. Who is the reservoir? Who is the source? It is only case of measles. And to the case of measles, you give such a beautiful vaccine which has 98% protection. Don't you think that the measles can actually be tackled? If you are better than measles, if your program is better than measles, theoretically, we can finish off measles. At least there can be areas which are measles eliminated. So just remember for your exam, what is the protection from this vaccine? The protection is up to 98% after the second dose. That is the reason we give 2 doses. Now you'll say that why don't we give 3 doses? But the protection rises very minimally after the third dose. The cost of third dose is much higher than the protection offered. But anyways, that is not at your level to understand that why don't we give third dose. But for now, just understand that the protection given is for your MCQ exams, that is 98%. Another MCQ which can be asked a lot of times in your exam is regarding the thermal sensitivity of the MCP. MCV stands for measles containing vaccine. This is again a frequently asked question in your exam. If you talk about the measles containing vaccine, the measles vaccine is both heat and light sensitive. It is both heat sensitive and light sensitive. That is why the color of the bottle, the color of the measles vaccine is always amber colored, and you as doctors, you should be knowing that the measles vaccine should not be kept outside. It is heat and light sensitive. Do you know that measles vaccine, if we keep at 37 degrees Celsius, it becomes zero potent. That means non-potent. It is non-potent within 1 hour. So if you keep the vaccine at 37 degrees, it becomes non-potent within 1 hour. The best time for measles, the best temperature for measles containing vaccine, it is 2 to 8 degrees Celsius. We don't freeze it. In case, this can also be MCQ, that because you already know that it is a freeze-dried vaccine and you mix it what? You mix it with diluent, that is the distilled water. So in case you are diluting it, the reconstituted measles vaccine, please note that the reconstituted measles vaccine should be used within how much time? You did it in immunology, so you did it in immunity and vaccine, so much we did, used within 4 hours. Reconstituted measles vaccine should be used within 4 hours. It does not follow the open vial policy. It does not follow the open vial policy. For more information on all this, you need to go back and watch your lectures in immunology, in immunity and vaccines, where we have discussed much in detail about the thermal sensitivity of not only measles vaccine, about other vaccines as well. As it happens with most of the vaccines, there is an effect. There is also a side effect. So what are the side effects of the measles vaccine? The side effect of measles vaccine could be measles-like illness. Please note that this is the most common side effect. The measles-like illness, it is a very short duration illness lasting 1 to 3 days only, with very low intensity fever. Very rash maybe there, may not be there, but there could be some fever which can happen. What is the incubation period of this measles-like illness, which is vaccine induced? It is roughly around 7 days. So that means you as doctors or the vaccinators should know it. And you should tell to the users also, to the mothers also, of whom children you are actually vaccinating, that after 6-7 days there could be some fever. So nothing to worry about it. Now this measles-like illness, this is what reaction? Is it because of the child problem or the vaccinator problem, or because of the vaccine itself? It is because of the vaccine itself. So we call it as a product related. It's a product related problem. But now you see another problem that is called as toxic shock syndrome. Is it a side effect of measles vaccine? Answer is no. Please note that toxic shock syndrome is a very rare phenomena. It happens only in case of the contamination of vaccine. So this happens because of contamination of vaccine. That means either the expired vaccine was used, or you left the vaccine open for a longer time, more than 4 hours, then there is contamination. So toxic shock syndrome, it talks to you about the quality of the immunization program. So toxic shock syndrome, I would not say it is not a side effect. It is adverse effect. And why is there this adverse effect? It is because of low quality of immunization program, because the people were not standardized, or persons were not educated enough, or they were not complying to the guidelines. That is what is the understanding about the toxic shock syndrome. Please note, which is the most common side effect? It is measles-like illness, which happens only after 6 to 7 days of the vaccination. And toxic shock syndrome is not actually a side effect. It is a adverse effect which talks about the quality of the immunization program. With the measles vaccine, you have to take care of some of the important things. It's a live attenuated vaccine. So common sense, this live attenuated vaccine is not given to cases with HIV. So with HIV, please note it is contraindicated. It is not given in cases of severe immunocompromised state. severe immunocompromised state is actually a contraindication. In measles vaccine, you should also know that pregnancy should be avoided. In pregnant female, you're not going to give measles vaccine, but if a adult person, female, takes measles vaccine, they should avoid pregnancy for 4 weeks. For next 1 month, pregnancy should be avoided after measles vaccine because it is a live vaccine. And tuberculin sensitivity test, it is also seen that the TST test, it may be done in children, right? So TST test will show decreased results. So therefore, the TST test, in case we are doing in measles vaccinated children, so this should be postponed till 4 weeks after vaccination. It should be postponed for 4 weeks after vaccination. And last is blood products and immune globulins. Of course, any blood product if we are giving and the child is already taking under the national immunization program, the child is supposed to be vaccinated. Please note that in case the child has received blood products or in case the child is going to get blood products, it should be avoided for 3 months. 3 to 6 months, depending on the level of the blood products which is given, 3 to 6 months should be avoided. After measles vaccine. After measles vaccine, for 3 to 6 months, the blood products should be avoided. So if you get single based answer, beta, please mark 3 months, at least 3 months, they should be avoided. So finally, these were the cautions. And what are the contraindications? Simple answer, you have done it so many times. What are the contraindications of the measles vaccine? It is contraindicated severe immunocompromised, pregnancy, severe acute illness, blood products and anaphylaxis and reactions towards neomycin and erythromycin because they are included in the measles vaccine. Last point is, how about the post-exposure prophylaxis in case of known exposure? In case of known exposure to measles virus vaccine, we should be giving some post-exposure prophylaxis, common sense. Now, what are the guidelines? If the person or the child is more than 9 months of age, the post-exposure prophylaxis of choice, the best post-exposure prophylaxis to be given to a person whose age is more than 9 months of age, that is measles containing vaccine. You give 1 shot of measles containing vaccine. This should be given within 72 hours of exposure. It should be given within 72 hours of exposure. That is the PEP of choice. Now, in case the child or the person is immunocompromised or there is any contraindication to the vaccine, or the child is age less than 9 months, or the child is age less than 9 months, in those cases, we may give the measles immunoglobulin. You may give the measles immunoglobulin. This also has to be given within 3 days. The dose is given as 0.25 ml per kg body weight. It is given as 0.25 ml per kg body weight to be given within 3 days. And because measles immunoglobulin, the effect may fade off and the child should be actually immunized now also. So it is always advised that in all the recipients of measles immunoglobulin, after 8 to 12 weeks after immunoglobulin, we should give a measles containing vaccine to the child. So that is about the guidelines about the post-exposure prophylaxis. Next is a few MCQs may be asked to you. What about the measles outbreak measures? See beta, please note that measles outbreak may happen in the area every 2 to 3 years. Measles does show a cyclic trend. So what are we going to do as public health professionals about the measles outbreak in these areas? What we do is something called as supplementary immunization activity. That is supplementary immunization activities. So in the supplementary immunization activity, which is done for what? It is done to combat measles epidemics or outbreaks in the area. What we give is a measles second dose, a 0 dose. What we give is measles dose 0. Now there are a lot of MCQs on this. What are the indications of giving the measles 0 dose? The indications for giving measles 0 dose is, one is any outbreak is there. in any displaced population or refugees or basically high-risk children we are talking of, any people, children who are traveling to any measles outbreak endemic areas, or infants born to HIV infected or exposed mothers. In those cases, we are supposed to give a measles zero dose. This measles zero dose can be given to age 6 to 9 months of age. So that is, you are lowering your criteria of giving the measles vaccine. So specific points for you to remember about the measles containing vaccine zero dose is it is given in case of outbreaks. It is given in case of high-risk children, and the age group, please note that the age group for this measles containing vaccine zero dose is 6 to 9 months of age. Another MCQ, which is such a frequently asked MCQ to me on social media, every day I get this question that this measles containing vaccine zero dose, if it is given at 8 months, are we going to give the measles containing vaccine first dose at 9 months? That means all the vaccines which are under the supplementary immunization program, the vaccine which is given under the SIA. So any vaccine which is given under the SIA, that is always taken as extra dose. So somewhere write it as big capital letters in your copy that the measles containing vaccine or the supplementary vaccines or the outbreak vaccines, they are always this extra dose. Me and you, we are very small to stop a national health program. It is such a big train. It's a big program. We don't stop a national immunization program. It is very difficult for us to explain to ASHA workers or Angan. So we just tell them, Anganwadi workers or ASHA workers or the ANMs or the nurses, that you have to immunize irrespective of whatever. Just please note that mind the gap. Mind the gap. How much gap should be there between two measles vaccine? Please note it should be more than 4 weeks, never less than 4 weeks. It should always be more than 4 weeks. So please note that, highlight this in big red color. It is the measles containing vaccine, that is the extra dose. Next and last point to cover measles is about the measles rubella second dose strategy. So when in India we were earlier doing only the measles containing vaccine, which was given, the measles vaccine was given in the first dose at 9 months of age. Then Government of India thought that why not to introduce a second dose also. So for that, the measles rubella vaccine was integrated and measles rubella was launched as the second dose. Are you getting it? So initially we were giving only the measles vaccine. The second dose was supposed to be launched. Instead of launching the second dose as measles dose, why not to launch a measles rubella dose as the second dose, because that is going to give you protection from measles and rubella, common sense. So what was the strategy to launch a measles rubella vaccine? See beta, the only point of me discussing you with this at this junction about the measles second dose is not for your PG entrance exam. In your entrance exam, you will not be asked about this because this is old strategy. But for all the UG students who are listening right now, and in case you are solving MCQs in your book, then you'll see that, sir, catch up, keep up, follow up was not there in the lecture. Are you getting it? So that's the only reason I'm discussing it. It is old strategy. It was taken to launch the measles second dose vaccine, the measles rubella vaccine. So currently we are in the follow-up phase of that vaccine. So what technically is it? Catch up means to give extra dose of measles rubella vaccine to all children. It was given to all children aged less than 15 years. That is what the catch-up campaign was. So if you are giving one extra dose, there will be people who had received one dose because earlier we were giving only one dose. So there will be people who had received one dose. Now they get the second dose. There will be children who had never received any dose. So they will get one dose. So at least everybody gets the one dose. That is what is catch-up. Then you keep up. Then you integrate the second dose. Then you integrate the second dose in the system and then you keep on doing that. That is what is follow-up. So currently we are in the follow-up phase of the measles rubella second dose vaccine integration strategy program, right? So that's all that you need to remember for measles. The next is mumps virus or the mumps disease. So let's talk about the epidemiological determinants of mumps virus. It's a viral disease. The mumps virus is a single-stranded negative sense RNA from the family Myxovirus parotitidis. And what is the source of the mump disease? So mumps disease, the source is either the person could be a clinical case or it could be a subclinical cases. So that means the subclinical cases are there in mumps. Please note 30 to 40% of all the clinical cases, of all the cases of mumps are actually subclinical. Okay, so this was not the case in measles. What is the period of communicability? If this is the onset of disease, if this is the onset of disease in measles, in mumps, it starts, the period of communicability starts from 4 to 6 days before the onset of mumps disease and till 7 days for the onset. So technically it is the child would be communicable for roughly around 10 to 14 days, which is a slightly bigger time. So the immunity, it happens to have a lifelong immunity, but the same problem, what is the secondary attack rate? In case the child is not immunized, the secondary attack rate is roughly around 85% for mumps as well. Next is, what are the host factors? That is kind of important from your MCQ exam. What is the specific age for mumps? Please note that measles, I told to you, measles, it usually affects the smaller children, less chota bacha, age less than 5 years or 3 years, right? The mumps is in a preschool children. That is what the question is. Preschool children. What is the preschool age? 5 to 9 years. So of course it's not 5 years, but 6 to 9 years. But anyways, preschool age group, you can remember, is for mumps, and it once the child will get mumps, they will have lifelong immunity. Environmental factors, nothing very special, is the same, that it spreads during the winter to spring months. What is the incubation period for mumps? The incubation period for mumps, it's a slightly longer incubation period ranging from 2 to 4 weeks. So if you get the average or the median incubation period, you can remember it as 14 to 18 days. That is the median incubation period, but the range is like long. It can have up till 1 month of incubation period. The mode of transmission is a droplet mode of transmission. Next is, what is the most common clinical features? The case of mumps will actually start with a high grade fever with swelling of glands, of the salivary glands. Swelling of the salivary gland, most common is parotid gland swelling. But actually mumps virus can cause infection and the inflammation of any organ of the body, ranging from testis, pancreas, CNS, or the ovaries. So it can cause a lot of complications. But however, the most common or the typical feature of mumps is parotitis. What are the complications? You can have, again, that same infection can happen at any point in time. And what is the most common infection? Please note that orchitis is the most common complication in mumps. Talking about mumps in pregnancy, please note that the children or the infants who are born to mothers who are pregnant and they get mumps infection, the chances of getting a congenital mumps is very rare and it has not been reported. But the point for you to know is that in case of pregnancy with mumps, there is a very high 1/4 chance, or there is a 25% chance of miscarriage or abortions in female who get mumps infection during their pregnancies. Otherwise, there's no chance of like having a congenital mumps infection. Talking about the mumps vaccine, you have different strains of the vaccine. It has low effectivity. All the vaccines regarding for the mumps has low effectivity. The only approved vaccine which has been incorporated into the MMR vaccine, that is the Geril-Lin strain. This Geril-Lin strain is the most commonly used strain. Please note there is one Rubini strain which has been taken back. So Rubini strain is not used anymore. It is not used anymore. The most commonly that we use is a Geril-Lin strain. Next one is a rubella, or the German measles. It has a very fancy name, rubella. It's such a cute disease. Why do I say cute? Because it is a very short-lasting disease. It is a very short-lasting disease. Why do I say short-lasting? It is roughly 3 to 4 days of fever and rash only. So people will get disease and they won't even come to know that something hit them. But of course, it has a very disastrous effect, very hazardous effect. It causes the congenital rubella syndrome. We are going to discuss everything. So we are talking about the congenital rubella syndrome. Right? For rubella. So MCQ number 1, what are the epidemiological determinants, beta? The epidemiological determinants, we are going to talk in terms of agent, host, environment factors. What are the agent factors? The rubella virus, it's a viral disease. It is a single-stranded RNA virus from the family Togaviridae. What is the source? A lot of times confusions and a lot of MCQs on this. The source is a clinical case or a subclinical case of rubella. So do you have subclinical cases in rubella? Yes, G, we do have subclinical case. 50 to 60% of all rubella infections are in fact subclinical. So out of all the expected rubella cases, majority are subclinical. Please note that if I just talk about the subclinical cases for measles, is there a subclinical case? There is no subclinical case. There is no subclinical case for measles. There is no carrier stage. For measles, in fact, we are almost very sure there is no carrier stage. There are some minimum, very few subclinical cases. Nowadays, the reports and the researches, we have started understanding that there could be few cases which are subclinical, but majority are clinical cases. So mumps has 30 to 40% of subclinical cases. Rubella has 50 to 60% of subclinical cases. So common sense, will they show iceberg phenomena? Yes, mumps and rubella will show iceberg phenomena. Will measles show iceberg phenomena? No, measles does not have iceberg phenomena. So just remember that which diseases will not show iceberg phenomena. The diseases which will not show iceberg phenomena are tetanus, rabies, measles. So according to me, some books would say that rubella does not show iceberg phenomena, but I do not understand that. According to me, beta, in your exams, common sense, the PARC also writes subclinical cases are there. So if the subclinical cases are there, of course, all the researchers also say subclinical cases are there. If the subclinical cases are there, there is iceberg phenomena. Simple. Let's move on ahead, right? So what is the source of rubella disease? It is a clinical or a subclinical case. What is the period of communicability? Let us say that this is the onset of the rash. If this is the onset of the rash, rubella is communicable from 7 days before the rash till 7 days after onset of the rash. So it is communicable again for a very long time, that is roughly ranging from 12 to 14 days it is communicable. What about the immune status in rubella? The immunity is again lifelong immunity from rubella, and people do not get rubella infections again and again, right? Next is about the host factors. If you talk about the host factors, there is an important consideration regarding age. Please note that we all might be living in a developing country, or we might be in a developed country. Now, there is a difference regarding the age distribution of rubella in developing and developed. So just like measles also, you had the same issues. In rubella, please note that in developing countries, it is seen from 3 years onwards till 10 years. So 3 to 10-year-old age group children are going to get rubella, but in developed countries, it is seen that more than 14-year age group is going to get. That is what is problem, because if more than 14 years and if the person is a female and if she is pregnant, then you are gone. Then that person is gone, because the child is going to get a congenital rubella syndrome, which is very problematic. So that is about the age factors. That is the reason in developed countries, they are making it very sure that the rubella vaccine is in place. That is what makes probably you to understand that why did we start. Many students ask me this, sir, that why did we start a measles rubella vaccine? Why not a measles mumps rubella? One is mumps vaccine is not so efficacious. Second, mumps is not such a big public health problem. And the problem more is with rubella. Now we have started seeing rubella cases in a higher age group. So before we actually land up in that 14-year age group, your rubella vaccine should be there in the country. So that is what makes this measles rubella vaccine. It was started in year somewhere around 2007-8. The plan was started rolling for launching the measles rubella second dose. So that's what about the host factors. Please note, one attack is going to give you lifelong immunity, and the age factor is different. Age peak incidence is different. Environmental factors, nothing very special. It happens mostly in the winter and the spring. In fact, that season is the viral season. At this season, many viruses they will transmit. What is the incubation period? The incubation period and the mode of transmission. The incubation period for rubella, it ranges from 2 weeks till 3 weeks. So it's again a very long incubation period. It's not a small incubation. Mode of transmission, it is primarily droplet-borne respiratory route of transmission. If you talk about rubella, the sign and features, it's also called as a 3-day sickness. Rubella is also called as a 3-day fever or a 3-day sickness. 3-day sickness or a 3-day fever. Why do we say a 3-day? Because it's a very short happening things. So there is initially a prodromal phase where there is light grade fever, plus or minus coryza, and so on, some non-specific features. Then there is lymphadenopathy. There is enlargement of the lymph nodes. Which lymph nodes are predominantly enlarged? It is the cervical lymph nodes and the posterior auricular lymph nodes. So cervical lymph nodes and posterior auricular lymph nodes are enlarged, but the cervical lymphadenopathy is very incipient. The patient will not come to say that I've got a cervical lymphadenopathy. So this lymphadenopathy is seen, but it's not a very characteristic feature. And rash is, again, it is inconsistent. It may happen in people, it may not happen, plus or minus. Rash is inconsistent. It is a very small rashes which may be plus or minus pruritic. It may be pruritic, itchy. It may be itchy. The rash would start from the face and then move downwards. So usually for all the rashes, you'll have a downward spread. And the point is that it is a small pruritic rash, very small rashes will be there, and it lasts only for less time. So usually the people will not even come to know they've got a rubella infection. That's how things are. How do you diagnose rubella? For rubella, there is a very sensitive and specific test, that is hemagglutination inhibition test. This test is a serological test. A person will get a test done only if they know that they have got some problem. So that's the reason many people don't get tested. But now the problem starts. The rubella, you can also do ELISA test. Now the antibody test is there for rubella, right? So what is the antibody we are going to test? We can either test a IgG or we can test a IgM. So in case we are doing a rubella test in a female, in a pregnant female, we should always do IgG or IgM, because IgG could also denote previous or the past infection. So therefore, what is the antibody we do in ELISA test in pregnant female? It is we do IgM test. We do serial IgM testing. Serial IgM test in case we know that probably the female has been exposed to rubella. So you do the IgM testing after every 10 to 12 days, because IgM would last for 3 to 7 days, right? So you do the IgM testing every 10 days and then you will come to know that whether the IgM is increasing or decreasing for rubella, what is happening. So a similar problem arises also in infants. Infant born to a rubella positive pregnant female. So in those cases, what are you going to test? Will you test the IgG or the IgM? Please note that if you test the IgG, there is a chance that G crosses placenta, right? So there is a chance that the baby got the IgG, and if you are testing IgG, the IgG could have been from the maternal transfer via the placenta. So if you are testing for IgM, that means the child must have made the IgM. And why would the child make IgM? Only if the rubella antigen was there. Are you getting it? So IgM testing is done in case of rubella and not the IgG. I think you would have understood this. So in children or in infants or in neonates who are born to rubella positive mother, they may land up into, there's a very high chance, like 25% chance of a child to develop congenital rubella syndrome. The classical triad of congenital rubella syndrome, you must have done much in detail in pediatrics. That is ophthalmic defects, that is there could be cataract, which is the most common. Then there is a sensory neural hearing loss, that is the auditory defect, and you have the patent ductus arteriosus, that is the cardiac defects. Of course, you can have a lot of cardiac defects. So primarily the peak age for a child to develop CRS is that if the rubella infection was happening 8 to 10 weeks of gestation, that is in very early pregnancy. You remember in early pregnancy, what are the two infections which are problem? It is the chickenpox, congenital varicella syndrome, and it is the rubella, that is the congenital rubella syndrome. So next, talking about the rubella vaccine. We have already discussed much in detail about the rubella vaccine in your lecture in immunity and vaccines, right? So rubella vaccines, a few MCQs just to reinforce the things. What is the strain beta? The strain is RA27/3. It is a live attenuated vaccine. It is a live attenuated vaccine. It is given with the measles rubella vaccine, right? That's what we have. The dose is same 0.5 ml. It is given as subcutaneous in the right upper arm. The immunity status, same answer for the immunity status. It starts around 11 to 12 days and it goes on for lifelong. It goes on for lifelong. So I would also like to bring to your attention another point over here. Beta, can you zoom into this in your devices? Can you zoom into this? What is written here? Can you see that the measles virus that is required in all the vaccines that we use, it is more than, or in this virus vaccine, in this vial, what you see is 1000 CCID50, 1000 CCID50, and the rubella virus is also 1000 CCID50. So, beta, please note that in all the measles rubella or the MMR containing vaccine or all the measles containing vaccine, the dose of measles virus should always be more than 1000 CCID50 or the plaque forming units, and similarly for rubella also it should be more than 1000 plaque forming units or the CCID50. What is CCID50? CCID50 stands for the cell culture infective dose 50%. What does it mean? It is how much amount of virus that you need to infect, to cause a death of cytopathic effects in 50% of the inoculate cell culture cells. So that is what is CCID50. So please note that the dose of measles and the rubella in the MR vaccine given in Government of India, that is always more than 1000. Next is that in these rubella vaccines, again, that same issues that we had in measles vaccine, the same issues would be here in the measles rubella vaccine. For rubella vaccine, pregnancy should be avoided for 4 weeks after taking the vaccine. So in case we are giving to a healthy female, the female should avoid pregnancy for 4 weeks after the rubella vaccine. Immunocompromised, it is not given in severe immunocompromised state. What do you mean by the severe immunocompromised state? Severe immunocompromised is if the child is HIV or the person is HIV symptomatic, or if the CD4 count is less than 200 cells, or if the relative CD4 count is less than 15%, relative CD4 count is less than 15% of what is expected. So that is, we have done it 100 of time about the immunocompromised and blood product recipient. Please note 3 to 6 months, the blood products should be avoided in people who are receiving the measles rubella vaccine. Regarding the rubella outbreak measures, we have already discussed during your section, during your lecture in immunity and vaccines, that there is a special target, there is a special mechanism of doing a rubella vaccination. Rubella vaccination in case of outbreaks, in whom are you going to do on priority? On priority, it is done in all WRA females. All WRA females, common sense, who are non-pregnant. You are not going to give rubella vaccine to a pregnant female. That's a live vaccine, right? So to all WRA females, we are going to give rubella vaccine. In the next level, all age group 1 to 14-year children will be given. And in the third phase, less than 1 year or at 9 months, we start giving rubella or the measles rubella vaccine in case of rubella outbreak. Another word of caution over here, that is that please note that rubella vaccine, the rubella vaccine or the measles and rubella vaccine is not given. It is not given along with, yellow fever vaccine, because they both may bind together. So rubella vaccine is not given with yellow fever vaccine because they both are live vaccines, and age less than 2 years, especially in age less than 2 years, the child may not develop the immunity for either of those. So neither the rubella immunity will develop nor the yellow fever immunity will develop. They are not given together. So just remember that there is only one contraindication. Otherwise, rubella vaccine in case of any outbreaks everywhere, it has to be given. Next is another WHO mandate, that is the global mandate for elimination of measles and rubella strategic framework, which was started in year 2021. Ending till 2030. This could be beta. Please take a note of it. This could be your prospective MCQ for your exam. This could be your prospective MCQ. So under this global mandate, under this WHO Big Daddy thing, so we want to stop measles and rubella in the country. How do you want to stop? First strategy, just 2-3 points. First strategy is to promote measles and rubella vaccination. You already know in children we want to promote measles and rubella vaccination. MCQ is one, that how much vaccination you want to promote. We want to promote it to have more than 95% coverage. So that is your first target, first understanding, first MCQ in this global measles rubella strategic framework. We want to have more than 95% coverage. Next is we want to have low cases, low incidence of measles. So how much low incidence of measles? We want to have less than, please note it is less than 5 cases of measles per million population per year. This is the upper limit we have set for ourselves. So we want to achieve this now. Did you get it? I told you that measles is such a wonderful disease that it happens only in humans, and you have such a beautiful vaccine. So why not to just stop the chain of transmission? So the level of measles that we want in our country should be less than 5 cases per million population per year, with a measles rubella vaccination coverage of more than 95%. And also combat any outbreaks. Two MCQs over here, any outbreaks. So one is that measles has outbreaks after every how many years? Measles, I think we had discussion on this, that measles has outbreak every 2 to 3 years. Do you know that rubella can also have outbreak every 5 to 9 years? So they both occur in cycles. So you should have a strategy. You should actually have a strategy to combat the outbreaks. How will you stop the outbreaks? You give them vaccines. What is the best way to prevent measles? Vaccine. What is the best way to prevent rubella? Vaccine. What is the best way to prevent congenital rubella? That is again vaccines. And also I would like to point out over here that there is a level in case of outbreaks. What do you do to measles case? Measles case. So in case of outbreak, you can just write down, in case of measles outbreak, one is we already talked about the supplementary immunization activity. In case of measles outbreak, you are also going to isolate the case. Isolation of the measles cases for at least 7 days after onset of rash. For at least 7 days after onset of rash. So one activity you do is supplementary immunization activity. Next is you do isolation, and you also give measles containing vaccine to all household contacts within 2 days of exposure. Within 2 days. So all household contacts age less than 15 years. So to age less than 15 years, we give this. So this is a strategy for combating measles outbreak under this global measles eradication framework. And for rubella, we already have discussed regarding the rubella vaccination special strategy. So with that, thank you so much for watching this whole module on measles, mumps and rubella.